Thrombophilia testing. British Society of Haematology recommendations. Introduction. The term thrombophilia is generally used to describe hereditary and/or acquired conditions associated with an increased predisposition to thrombosis. Heritable thrombophilia refers to genetic disorders of specific hemostatic proteins. The most clearly defined heritable thrombophilia are the factor V Leiden, FVL, variant, the prothrombin gene variant, protein C deficiency, protein S, PS, deficiency, and antithrombin, AT, deficiency. Important acquired thrombophilia include the antiphospholipid syndrome, APS, paroxysmal nocturnal hemoglobinuria, PNH, myeloproliferative neoplasms, MPN, and the presence of a JAK2 mutation in the absence of an MPN phenotype. Pregnancy is a hypercoagulable state due partly to physiological changes in both the coagulation and fibrinolytic systems. Heritable and acquired thrombophilia can interact to further increase the risk of thrombosis, for example during pregnancy and the puerperium. General thrombophilia screening recommendations. Testing for heritable thrombophilia traits after a venous thrombotic event is not recommended as a routine to guide management decisions, Grade 2B. Please discuss with hematology registrar or consultant to see if your patient needs heritable thrombophilia screening or not. Genetic testing to identify causative variants responsible for phenotypically identified deficiencies of antithrombin, protein C, protein S should be performed when the results will influence management, Grade 2B. Testing for deficiencies of physiological anticoagulants should be performed only after 3 months of anticoagulation for acute thrombosis, Grade 2B. We do not recommend offering routine thrombophilia testing to first-degree relatives of people with a history of venous thromboembolism, Grade 2B. We suggest selective testing of asymptomatic first-degree relatives of probands with protein C, protein S, and antithrombin deficiency where this may influence the management and life choices depending on personal circumstances, Grade 2B. Genetic testing for variants in genes, e.g., MTHFR, SERPINE1 variants, PAI1 plasma level, without a clinically significant link to thrombosis is not recommended, Grade 2C. Heritable thrombophilia testing recommendations. Less than 40-year-old and 2 or more symptomatic venous thromboembolism episodes in family members. Children with purpura fulminans, protein C and S. Select asymptomatic first-degree relatives of people with protein C, protein S, or antithrombin deficiency where the results may influence the management and life choices of the individual. Pregnant women at risk of thrombosis, where a positive result will change their risk group. For example, an asymptomatic pregnant woman with a family history of venous thromboembolism in a first-degree relative would change their score from 1 to 2 or 4, depending which thrombophilia. Acquired thrombophilia testing recommendations. We suggest testing for paroxysmal nocturnal hemoglobinuria in patients with thrombosis at unusual sites and abnormal hematological parameters, i.e., cytopenia and abnormal red cell indices, or evidence of hemolysis, i.e., raised lactate dehydrogenase, bilirubin, and reticulocyte count, Grade 2C. We recommend testing for MPN panel, including JAK2V617F, JAK2XN12, CALR, MPL mutation analysis, in patients with thrombosis at unusual sites and with full blood count abnormalities suggestive of a myeloproliferative neoplasm, Grade 1C. We suggest testing for JAK2 mutation in patients with splanchnic vein thrombosis or cerebral venous sinus thrombosis in the absence of clear provoking factors and a normal FBC, Grade 2C. Antiphospholipid screening recommendations. Screening for antiphospholipid antibodies is recommended following unprovoked VTE because this may alter management including choice of antithrombotic therapy, Grade 1B. Screening for antiphospholipid antibodies is suggested in patients with VTE provoked by a minor risk factor as this may alter management including choice of antithrombotic therapy, Grade 2C. Patients with acute multiple thrombotic events and evidence of organ failure suggestive of catastrophic antiphospholipid syndrome should be tested for antiphospholipid antibodies, Grade 1A. As antiphospholipid syndrome is an acquired thrombophilia, screening for antiphospholipid antibodies is not recommended in family members of patients with thrombosis, Grade 1A. Thrombosis at unusual site recommendations. We do not recommend testing for heritable thrombophilia in patients with thrombosis if the only indication is thrombosis at an unusual site because the association is weak, and management would not be changed by their presence. Grade 2B. We recommend testing with MPN panel in patients with thrombosis at unusual sites with full blood count abnormalities suggestive of a myeloproliferative neoplasm. Grade 1C. We suggest genetic testing with JAK2 mutation in patients with splanchnic vein thrombosis or cerebral venous sinus thrombosis in the absence of clear provoking factors and a normal FBC. Grade 2C. We recommend testing for antiphospholipid antibodies in patients with thrombosis at unusual sites in the absence of clear provoking factors as the type and duration of anticoagulation are affected by the presence of these antibodies. Grade 1A. We suggest considering testing for paroxysmal nocturnal hemoglobinuria in patients with thrombosis at unusual sites and abnormal hematological parameters, i.e. cytopenia and abnormal red cell indices, or evidence of hemolysis, i.e. raised lactate dehydrogenase, bilirubin and retics count. Grade 2C. Testing for antiphospholipid antibodies may be considered in patients with retinal vein occlusion in the absence of any other risk factors associated. Grade 2C. Arterial thrombosis recommendations. Testing for heritable thrombophilia is not recommended in patients with arterial thrombosis as the association between heritable thrombophilia and arterial thrombosis in adults is weak and does not alter the management. Grade 1B. We recommend testing for antiphospholipid antibodies in patients with arterial thrombosis in the absence of other vascular risk factors. Grade 1B. In patients with arterial thrombosis and relevant abnormal blood parameters, consider testing with an MPN panel and for paroxysmal nocturnal hemoglobinuria. Grade 2C. Ischemic stroke recommendations. Testing for heritable thrombophilia is not recommended in patients with stroke, regardless of age. Grade 1A. Testing for antiphospholipid antibodies should be considered in young, less than 50 years of age, patients in the absence of identifiable risk factors for cardiovascular disease because this may alter management including choice of antithrombotic therapy. Grade 1A. In patients with stroke, an abnormal full blood count should prompt consideration for testing with an MPN panel and for PNH. Grade 2C. The presence of a patent foramen ovale in patients with a stroke is not an indication for thrombophilia testing. Grade 2C. Pediatrics thrombophilia screening recommendations. Neonates and children with purpura fulminans should be tested urgently for protein C and S deficiency. Grade 1B. Thrombophilia screening is not routinely recommended for neonatal stroke. Grade 2B. In neonates with multiple unexplained thrombosis, especially with clinical evidence suggestive of catastrophic antiphospholipid syndrome, testing for antiphospholipid antibodies and heritable thrombophilia should be considered. Grade 2D. Thrombophilia testing in relation to pregnancy recommendations. Testing for antithrombin deficiency may be considered in pregnant women with a known family history of this deficiency or evidence of heparin resistance. Grade 2C. In women with a history of unprovoked VTE, testing for antiphospholipid antibodies should be performed outside pregnancy. Grade 2B. We recommend against heritable thrombophilia screening in women with pregnancy complications, such as recurrent miscarriage or adverse pregnancy outcomes. Grade 2B. For women with recurrent or late pregnancy loss, screening for antiphospholipid antibodies can be considered as the results aid risk stratification and treatment decisions. Grade 2B. Antiphospholipid antibody testing should be avoided during pregnancy as the results may not be reliable. Grade 2B.